Jeff Slauson here from 19 News Now at the 19 News Digital Desk. Today, Lorain County released the new health initiatives for the next 3 years or so. It's going to start here in 2023 and expand to 2025, essentially gearing the health department in Lorain County toward the right place where they want to hopefully provide the best care and also the best health options for people living in the county. They have it split up in 5 different ways. We spoke with Lorain County earlier today, and here's what they had to say in our interview. Kind of start off here, the announcement today related to the health improvement plan for Lorain County. For those that are unfamiliar with it, for those that aren't familiar with this announcement, kind of just give the nuts and bolts elevator pitch on exactly what this is and what this plans to do.
Sure. So every 3 years, we do a community health assessment in Lorain County. We make sure that we align that assessment with similar work being done with our partner healthcare systems. The assessment kind of guides us on what priorities to focus on, and the follow-up to the assessment is actually drafting the Community Health Improvement Plan, also known as the CHIP plan, which actually identifies strategies that we will be implementing over the next 3 years to try to improve the health status of residents in Lorain County.
When we consider the health status of Lorain County as a whole right now, where are some of those main areas that need improvements and main areas that need the attention?
Sure. So our top 5 priorities have not changed in recent years. So they remain cancer, chronic disease, mental health, substance use disorder, and cancer, as well as maternal and child health. So between the last assessment and this one, those priorities remained unchanged, and now it's a matter of implementing the strategies to address those.
When you say those priorities haven't changed here, is that because they've become bigger issues? Is that because Lorain County wasn't able to tackle them the way that they had hoped to during the last improvement plan? Why are they still those main problems?
So we sometimes see different populations experiencing more adverse effects of some of those issues that I identified, and that can sometimes change on occasion. So for instance, when you're looking at chronic disease, such as diabetes and cardiovascular disease, we're actually seeing an improvement in the rates of mortality from cardiovascular disease in those older than 75 years. But we're seeing a negative impact in younger people. So we kind of keep the priorities the same, but move our targets and parameters around a little bit to make sure that we're impacting the population that needs it the most.
What are some of these plans? What are some of these things that will be done to help to improve the lives of people in those categories we talked about?
So the great thing about Lorain County is that we have a ton of really engaged people and partners in the county who are already working on projects and tactics that can address some of these issues. And from our perspective, it's really a matter of working together and identifying and looking at some tactics and strategies with more of a laser focus, so that when funding opportunities come around, or advocacy opportunities come around, or policy opportunities come around, we're really a united front, not just Lorain County Public Health, but all of our partner agencies and healthcare systems in the county, looking to seek funding, advocate for change, advocate for policies. And that really is the beauty of how we've kind of designed this next iteration of our CHIP plan.
We've been, as a country, very heavily focused on COVID-19 over the past few years here, understandably so, and very much so is still a problem. But we are showing that there are other health issues very much so still present here. Is that, in addition to all the reasons that we just mentioned, is that also a reason why it's important to kind of put the focus on these to show, yes, COVID-19 has been a big deal and has taken a lot of the focus even from us in the media, but there are still many health problems that we need to focus on as well?
Yes, and COVID-19 in some respects exacerbated conditions that were already negatively impacting health and really widening the gap in terms of health disparities in the county. So for instance, when we look at cancer, we would venture to believe that one of the reasons we may be seeing an uptick in late stage diagnoses is that for a time, particularly when we were going through COVID, there may have been a fear of going out and getting screened for cancer in a timely manner. So that's just one kind of effect that we're seeing from COVID where that had a role. In addition, we know that COVID was not just a health issue, right? It really highlighted and spotlighted a lot of issues that we associate at the health department with the social determinants or social drivers of health. So when we're looking at things like education, economic stability, housing, those are all things that impact health and impact health outcomes. And again, in some populations, in some areas, the impact of COVID-19 made some of those conditions even worse than they were before.
The other one that sticks out to me is in the mental health realm. Many people who maybe were suppressing some of the issues that they potentially had, quarantining, the fear of COVID-19 definitely brought those things up there. Obviously, that is a priority under this initiative.
Yes.
When we consider where we hope to be in 2025, what would you say is a success?
I think a success would be looking back and knowing that we made a measurable impact in at least one of the strategies that we've outlined in our plan that we released today. The data drives us, and being able to closely measure, are we moving the needle on this issue or not, is going to be imperative to helping guide our work over the next 3 years, or perhaps informing us that we need to pivot. And so looking back and understanding, like, we really use the data at our fingertips in a productive way to either pivot or kind of stay the course. And at the end of the day, we made an impact. We'll consider that a success.
So we have everything available on our website right now at cleveland19.com. Links to all of this information and how to get involved with all of this as well. You will see us coming up on 19 News at 10 and 11 CW, then of course on CBS. We will have our weather stream starting up at 9:15, so in about a half hour, so hope to see you there. For now, I'm Jeff Slauson with 19 News. Have a great day, a great night, and a great weekend.
19 News.